Good afternoon. I'm Dr. Mikhail Kosiborod, a cardiologist at St. Luke's Mid-America Heart Institute in Kansas City, an associate professor of medicine at the University of Missouri, Kansas City. Today I will be speaking about the TERISA study, which is evaluation of ranolazine in patients with type 2 diabetes, coronary disease, and chronic angina. Chronic angina is a common problem which affects about 8 million patients in the United States, with significant impact on patient symptoms and quality of life, and is a major driver of healthcare costs and hospitalizations. Patients with diabetes tend to have greater burden of angina than patients without diabetes. Ranolazine, which has been previously shown to be an effective anti-anginal agent, may also lower fasting glucose and hemoglobin A1C. However, the anti-anginal effectiveness of ranolazine in patients with type 2 diabetes has not been previously studied in a prospective fashion. To address that gap in knowledge, we performed the TERISA study, which was a randomized, double-blind, placebo-controlled trial of ranolazine versus placebo in patients with type 2 diabetes, coronary artery disease, and chronic angina. TERISA was an international study. Patients were recruited from about 105 sites in 14 countries. There was a pre-specified geographic stratification into patients that were recruited in Russia, Ukraine, and Belarus versus those recruited in other countries. Patients after screening were entered into a 4-week, single-blind, placebo run-in period. And the purpose of the placebo run-in was to establish baseline angina frequency, as well as to document compliance with assigned medication, as well as a symptom diary. Following the placebo run-in, patients were randomly assigned to either ranolazine with a target dose of 1,000 milligrams twice a day versus placebo in a double-blind fashion for a treatment phase of 8 weeks. Following the 8-week treatment phase, there was a 2-week follow-up safety phone call. Patients reported their own symptoms of angina frequency and sublingual nitroglycerin use using a novel electronic diary with daily data transfer. The primary endpoint of the TERISA study was average weekly angina frequency between weeks 2 and 8 of treatment, and a key secondary endpoint was weekly sublingual nitroglycerin use, also reported between weeks 2 and 8 of treatment. Baseline characteristics were well matched between patients in the ranolazine and placebo groups. Of note, there was a very high use of concomitant medications such as statins, antiplatelet agents, ACE inhibitors, and angiotensin receptor blockers in both groups, placebo as well as ranolazine. The compliance with the electronic diary was also very high in both groups at 98%. For the primary endpoint of weekly angina frequency, at baseline, there were no differences between ranolazine and placebo. However, between weeks 2 and 8 of treatment, there was a significantly lower angina frequency in the ranolazine group as compared with the placebo group, 3.8 versus 4.3 episodes per week, with a significant p-value of 0.008. For the secondary endpoint of sublingual nitroglycerin use, again, at baseline, there were no differences between ranolazine and placebo groups, but between weeks 2 and 8 of treatment, there was a significantly lower use of sublingual nitroglycerin in the ranolazine as compared with placebo group, 1.7 versus 2.1 doses, with a significant p-value of 0.003. In subgroup analysis, the therapeutic effect of ranolazine versus placebo differed in patients that were enrolled in Russia, Ukraine, Belarus, and other countries. In other countries, there was significantly lower angina frequency in patients assigned to ranolazine as compared with placebo, 3.1 versus 4.1 angina episodes per week, with a highly significant p-value of 0.002. However, in patients enrolled in Russia, Ukraine, and Belarus, there was no significant differences between the ranolazine group and a placebo group. The explanations for this geographic stratification are currently being actively explored. In addition, in exploratory post-hoc analysis, we found that the therapeutic effectiveness of ranolazine versus placebo and angina frequency differed by baseline hemoglobin A1C. Specifically, patients who had higher hemoglobin A1C experienced greater benefit from ranolazine as compared to those patients in the placebo group, compared to patients that had lower baseline hemoglobin A1C. There are several potential mechanistic explanations for this interaction, and again, we're actively exploring that as well. So in conclusion, TERISA study demonstrated that ranolazine was superior to placebo in reducing weekly angina frequency and sublingual nitroglycerin use. in 927 patients that were randomized in the study. The therapeutic effect of ranolazine and its benefit was greater in patients recruited outside of Russia, Ukraine, and Belarus, as well as those who had higher baseline hemoglobin A1c. Finally, the clinical implications of this is ranolazine clearly appears to be an effective anti-anginal agent in patients with type 2 diabetes who are very high risk and therapeutically challenging group. The potential dual effect of ranolazine, both on reducing angina as well as lowering fasting glucose and hemoglobin A1c, needs to be further explored in future clinical trials. Thank you.